Good afternoon. My name is Naomi Cytron, and it's my pleasure to welcome all of you to today's conversation, Investing in the Future of Childcare, Supporting Small Business Providers. This webinar is the first in a month-long series of webinars focusing on the roles that public, private, and nonprofit sector actors can play in strengthening the early care and education ecosystem. It's also the kickoff to a partnership between the Federal Reserve Bank of San Francisco's Community Development Department and the Low Income Investment Fund, known as LIIF. Through our jointly designed initiative, Investing in the Future of Childcare, we'll be working together to help stakeholders throughout the Fed's 12th district, the 9 Western states, including Alaska and Hawaii, to take a deep dive into the challenges facing the childcare market, as well as the investments and partnerships needed to support childcare providers and working families. We'll do this through a handful of channels. First, this webinar series, which is designed to advance understanding and action in the field. Each webinar this month will explore the childcare system from a different angle and offer ideas for the roles various community partners can play to support it. Following today's webinar, you'll get an email with links to register for the next installments, taking place during the same time slot for the next 3 weeks. We're also publishing research that uses data to illustrate the necessity of childcare to the labor force and to the economy. Research products will also highlight race and income-based inequities in the childcare system, including disparities in access to childcare and in providers' access to resources. The next stage of our work will aim to support communities on the ground by connecting partners and fostering learning opportunities across regions. We'll engage with existing local and regional childcare-focused coalitions or support the formation of new ones to identify and implement solutions that benefit both childcare providers and working families. Following this webinar, you'll get a survey which will allow you to sign up for the next steps in this phase of the initiative. All of these efforts are in service of helping stakeholders across sectors reimagine and retool the childcare system so that lower-income families and people of color can access and afford childcare that both enables parents to participate in the workforce and boost child well-being and readiness to learn. As our speakers will highlight, access to childcare strengthens our workforce and our economy at large. However, childcare providers, which often operate as small businesses, are struggling, and the COVID-19 crisis has generated new cost constraints that compound pre-existing challenges. We can and must do more to invest in the care and education of young children in order to rebound into an economy that works for everyone. We are extremely lucky today to have an expert panel on hand to help us understand the current childcare landscape, as well as some of the pathways for supporting early care providers. We'll first hear from my colleague Bina Srimali, who manages the Community Development Research Team at the Federal Reserve Bank of San Francisco. In this role, Bina conducts research on the structural barriers to economic opportunity for low-income communities and communities of color, and provides guidance for the department's research agenda that advances healthy and resilient communities, a thriving labor force, and inclusive financial systems. Then we'll hear from Rob Grunwald, an economist with the Federal Reserve Bank of Minneapolis. Rob is a longtime leader in conducting research and outreach on the economic and social impact of early learning, starting with a seminal 2003 report that quantified the economic returns from investments in early childhood development. We'll then hear from Angie Garling, the National Director of Early Care and Education Programs at LIIF. Angie brings not just her experience at LIIF to the conversation, but also her perspectives from serving for the past 25 years as an advocate, funder, policy analyst, researcher, and program developer dedicated to quality care and education for all children. Finally, we'll hear from Amy Anderson, Government Affairs Director for the Association of Washington Businesses. In this role, she has been pivotal in elevating early care and education issues among chambers of commerce, business leaders, government agencies, and legislators in the state of Washington. Following all the presentations, we'll have a chance to engage in dialogue, and we welcome you to submit questions throughout the program through the Q&A or the chat feature. Looks like, as we hoped, we have a pretty eclectic group of attendees today. Really excited about that, partially because we know that this work involves partnerships across sectors, and having each of you understand where you can play a role in this work is critical. I'm going to stop sharing this and cross out, and Bina, I'm going to turn the microphone to you. Thanks so much.
Okay, here I go, sharing my screen. Great, thank you, Naomi. I'm really happy to be here. I want to start by saying that at the SF Fed, our vision in community development is for a healthy and inclusive economy in which all people can participate and no one is left behind. And in order to work toward that vision, we conduct research and convene and foster partnerships to remove the structural barriers to economic opportunity for low-income people and for people of color. And we know that childcare is a significant barrier to economic opportunity for many families. So I'm excited to be here to talk about this. And I just want to start by saying the views I expressed today are my own and not necessarily those of the SF Fed or the Federal Reserve System. So lack of childcare is obviously essential to our economy. Given its important work, it really fits into the Fed's larger mandate for maximum employment. So today I'm going to be talking about how childcare is important to our economy, to reducing gender and racial gaps, and also just want to highlight the point that childcare as a sector has been undervalued and overlooked. I'm also going to share some data from the 9 Western states, which is the SF Fed's district. So first I want to start by just highlighting that childcare is critical for our current and our future workforce. Here you can see that about 1/3 of the US workforce has children under 18. And also when we think about all of the growing research around the importance of the early years, we note here that children under 6 have all available parents in labor force. So the opportunities provided by childcare providers are really essential for laying the groundwork for our future labor force. And our research also tells us that childcare affects work decisions. This survey conducted prior to the pandemic by care.com showed that nearly 2/3 of parents had made career and workforce changes based on childcare costs. For example, they changed jobs for higher pay, asked for a more flexible schedule, or switched from full-time to part-time to save money. We also know from this survey that people make a lot of household financial decisions based on childcare. For example, respondents reported accruing more debt to afford childcare, stopping saving money, stopping paying off debt, and making other cuts to household spending. And so we know that there are important implications for households in terms of job decisions, in terms of financial decisions. And also, it's important to highlight that moms especially felt the impact of childcare on their careers. In this survey, over half the moms who were surveyed reported scaling back on their hours to save on childcare, and 25% of moms left the workforce altogether. And indeed, historically, women have really borne the brunt of childcare responsibilities, and this pattern continues to this day. While 93% of men who have children under 6 are employed, this share is only 64% for women. And in addition, time use survey data tells us that across all income levels, working women spend more time on childcare responsibilities than men. And this disproportionate impact is really important. This current recession has been described as a women's recession. And women's unemployment has risen sharply, more sharply than men, particularly for women of color. And part of this decline stems from the fact that women are more likely to work in service industries that have been hard hit and don't allow for remote work. But at the same time, we're seeing that the burden of childcare really plays a story in contributing, plays a part in the story about women leaving the labor force. So despite these challenges, women's contributions to household earnings has increased over time. So in 1967, 28% of mothers contributed at least a quarter to household earnings, and that has risen to 64% in 2017. It's important to note that these numbers vary by race ethnicity. So here you can see for Black women, they're much more likely to be the main breadwinner, and combining with contributing at least 25%, childcare plays a really critical role in ensuring household stability for Black families. And what's important to note here is that labor force participation for Black women is higher than for other racial ethnic groups, for women in other racial ethnic groups. And Black and Hispanic workers are more represented in low-wage jobs. And so the other thing is, looking at time use survey data, we see that Black women spend more time on work regardless of the presence of young children, which is higher than the other racial ethnic groups. So really, when we put all that together, and we also realize that now in the US, the majority of young children are now people of color, we really see that we have an opportunity to invest in this future workforce and to ensure that we are reducing these racial and gender gaps in our economy. So to illustrate a little bit about how this sector has been undervalued. There's a lot of different ways to make this case, but I wanted to really focus on childcare workers and how childcare workers struggle to make ends meet. And what's really important to note here is we have all this research telling us how important this time period is, and we still see that workers in the sector are not paid well. So here is a chart that tells us, on the whole, childcare workers make $10.72 per hour on average, and that's at the second percentile of earnings. And kindergarten teachers, by contrast, are making at 61%. I'm sorry, $31.29 an hour, which is at the 61st percentile. So this is a useful comparison because kindergarten teachers are often working with children who are around the same age or slightly older. And so this tells us a really interesting story about childcare and how childcare workers are not being paid well. And there are significant racial ethnic issues here, racial ethnic disparities here as well. So you can see here that 1 in 6 childcare workers are living in poverty, and that this number rises to 1 in 4 for Black childcare providers and 1 in 5 for Hispanic childcare providers. And it's also important to note that the childcare workforce is almost completely women. So these disparities are really significant and important. And also just in general to note, 59% of childcare workers live in households that make incomes below the national median. So I'm going to share a little bit of data across the Federal Reserve's 12th district, which is the 9 western states. Here you can see that in the United States, over half of people live in childcare deserts. And for our states, the majority of them are higher than that. We range from 48% in Arizona to 77% in Utah. And the way that this is defined is that a childcare desert is a census tract with more than 3 children under age 5 for every licensed childcare slot. And this chart shows us that for the United States on the whole, low-income people are more likely to live in childcare deserts. And this holds for most of our states across our district, except for Utah, Alaska, and Idaho. So while we know childcare supply is an issue, so is cost. So I'm just going to give a little snapshot here. This is infant care cost by state, which ranges from $7,500 for Idaho to nearly $17,000 for California. This is the annual cost of infant care. And you can see here, this is cost for a 4-year-old, which are slightly lower, $6,500 in Idaho to about $11,500 in California. And just to give a little more context around these numbers, if we look at the cost of infant care as a share of the state's minimum wage earnings, we get a sense of how much families, low-wage workers in particular, are paying in childcare costs. In Arizona, it's 48%, and in California, 68%. And putting a little context on this number, the federal standards suggest that families shouldn't be paying more than 7% of their income on childcare costs. So we are a long ways away from meeting that standard. So to summarize, childcare is essential infrastructure. We know it's critical for people to be working, and also it represents an investment in our future workforce. And I want to really, for us to consider this question, is childcare a public good or a private responsibility? We know that national public subsidies reach just 15% of eligible low-income families. And we also know that these subsidies do not cover the care costs in most cases. So finally, I'll leave you with this question. What is your role? What is your role in supporting and bolstering this critical sector of the economy? And, I want to acknowledge in the very real struggles and challenges that COVID has posed to us, we also have an opportunity to reimagine this sector and to really bolster it for our shared economic prosperity. So with that, I'll turn it back over to Naomi. Thank you.
Thanks so much, Bina. Even though I knew those statistics were coming, they still are really shocking and staggering. And I also really appreciate your highlighting some of the racial and gender gaps in this work. And I think it points out that we need to think in really nuanced ways as we develop interventions to help support the sector on the whole. We're going to get into a little bit more conversation about the real challenges facing the childcare business model. So wanted to launch one more poll to see how familiar you are with some of the issues that are currently facing, that have historically challenged the business model, and how this has changed in the COVID moment. I'll give you 3 more seconds. We've got a good showing. All right, again, we have a really diverse audience, which helps us think through how we need to position our work so that everyone can see what they need to learn, what they need to help teach, and how we can help support each other in this work to make sure that we're all up to speed on the issues that are really important to helping us advance the work. So with that, I'll stop sharing and turn the mic over to Rob.
There, now you can hear me. And you can see my slide okay as well. Great. So as mentioned, I've been working on looking at the economic return on investments in young children for a number of years. We recognize that there can be a very high return on investing and supporting children's development and their school readiness. Today, we're looking more at the 2-generation approach in terms of how high quality childcare can affect parental employment. And Bina, I think, set the groundwork very well here for this discussion, the data you provided. I'm going to just add a couple other points of data on this. And before the pandemic, there was a number of states that had measured the economic impact of a lack of childcare supply and reliability on parents, businesses, and taxpayers. And they found a substantial impact. I know that there, within the 12th district, there's at least some studies for Washington and Idaho. And the Minneapolis Fed, we're just about ready to release our reporting on a survey that we partnered with the University of Montana and the Bureau of Business and Economic Research there. And based on a pre-pandemic survey of households, we found that households, parents, they lost $145 million due to missing work, switching from full-time work to part-time work, or turning down a job offer because of inadequate childcare. Businesses lost $55 million in 2019 due to lower employee productivity and higher turnover rates, and taxpayers lost $32 million. And this is a relatively smaller state compared to many in the 12th district. So indeed, childcare serves as an important component of workforce infrastructure. 2/3 of all children under age 6 have all of their parents in the labor force. And this sector represents 675,000 small businesses in the country and more than 1.5 million workers and self-employed family childcare home operators. But childcare is a challenging business model. Many of these small businesses operate on thin margins. The vast majority of revenue in the market comes from parents' tuition payments. And parents with young children are typically in their early earning years of their careers, and many bring home less income than they will in their later years while facing costs associated with family formation, such as renting or buying a large living space. This means many childcare providers have little room to raise their rates. On the cost side of a childcare provider's ledger, it's driven by hired labor. And this is of course, the essential component of providing childcare. And as Bina pointed out, wages in the childcare sector are already low. So with providers unable to lower wages further or to reduce staff levels, there are few opportunities for finding efficiencies or cutting costs in this sector. Furthermore, childcare providers usually come to the profession with a background in child development, not necessarily business. And business technical assistance can be an important strategy for helping providers build capacity to operate sustainable businesses. And developing cross-sector partnerships, as Naomi mentioned earlier, at the local and the state level, between childcare providers, the local business sector, and government entities, they can help overcome a number of these market barriers. So here's my disclaimer slide. So moving now to the discussion about the impact of COVID-19 pandemic on childcare. So back in the spring, there was increased unemployment, working at home. This led to a sharp drop in demand for childcare. The Bipartisan Policy Center had a survey in early April, and it showed that 61% of parents reported their childcare provider closed. Operators have been operating at reduced capacity, according to a June survey of from the National Association for the Education of Young Children. 86% of childcare providers reported serving fewer children, with an average of 67% decrease in enrollment. Furthermore, several states closed childcare programs except for those serving essential workers. In this Childcare Aware of America map from May, states in blue kept childcare open. Other states closed childcare, with exceptions for those providing for care for essential workers. A key role for childcare during the first few months of the pandemic was providing care for essential workers, including healthcare, emergency, and other jobs classified as critical infrastructure. Policymakers recognize that without childcare, essential workers with young children couldn't get to their jobs. The Atlanta Fed estimates that there's 2.6 million of the nation's healthcare workers and first responders who are parents to children under 14 years old that need childcare. A recent survey of parents by the U.S. Chamber of Commerce Foundation shows that there's a lot of volatility in childcare arrangements, which makes it challenging for both parents and providers to predict the future. In this survey, almost half of working parents are now working remotely. 75% of working parents currently have children staying at home. 65% of parents have changed their childcare arrangements, and 60% of parents expect to change their childcare arrangements within the next year. A survey of employers by the U.S. Chamber of Commerce Foundation found that employers do recognize that childcare is an important part of workforce infrastructure to help parents to return to the workforce during the economic recovery. 79% of employers have shifted a significant part of the workforce to remote. 40% of employers have offered additional childcare accommodations, primarily flexible schedules. And 40% of employers are concerned that some employees will not fully return. The pandemic created a number of financial challenges for childcare providers as they needed to modify practices in order to address COVID safety and health-related concerns. For example, child drop-off and pickup practices may be more labor-intensive, and staff may be required now to perform daily health checks on children. Other costs include hiring substitute teachers or closing classrooms for 2 weeks following COVID exposure, which can be very disruptive to provider operations. Some providers are making alterations to their facilities to accommodate social distancing, and providers also need access to basic cleaning supplies and personal protective equipment. The largest financial impact comes from a 10-person group limit on ratios. Many, but not all, state health departments apply the general CDC guidance for a 10-person group limit to child care center classrooms and home-based family child care providers. The child staff ratio refers to the number of children to staff in a classroom. Group size is the maximum number of children in a classroom. This is examples from Minnesota, but it applies broadly to other states as well, although the details will be slightly different. So here you can see the impact on the 10-person limit on ratios for preschool and school age classrooms, and group size for all classrooms except for infant classrooms. For toddler classrooms, the size was essentially cut in half, preschool classrooms by more than a half, and school age classrooms by more than a third. So while there's some variable costs that go down since there's fewer children, such as laying off assistants or some teachers, but revenue falls more than costs, as lower revenue is spread across fixed costs. So toddler classrooms, we see that the monthly cost increase is about $2,000 per classroom. Preschool classrooms, the monthly cost increased by $2,500. Many small home-based provider family childcare providers are not affected by the smaller group size, except for those serving more than 8 or 9 children. There has been support for the sector. For example, in the spring, the CARES Act provided $3.5 billion, which is distributed through existing state block grants. Some states allocated general revenue to the sector or helped childcare providers acquire sanitization supplies and PPE. More is needed. The Senate Majority's relief bill includes $15 billion for childcare, and some House plans propose as much as $50 billion. And it's yet to be seen how those plans will move forward. There are concerns that these small businesses may not be able to weather the pandemic without more government assistance. And if providers that can't cover their costs end up shutting down permanently, they may not be easily replaced by new market entrants. Childcare businesses, and especially childcare centers, can face steep costs to enter or re-enter the market. For example, providers must often make significant capital investments in a commercial or residential property to convert it to an appropriate space. Childcare providers often struggle to find credit for such investments during normal times. During the pandemic, credit may be even more difficult to access due to uncertainty about market conditions. So I'm going to turn it back to Naomi. So thank you.
Great. Thank you, Rob. I mean, I think that these issues are all really critical to think through, especially as we collectively come to terms that what we're in right now is going to be a long-lasting new normal, as much as we don't want to admit that to ourselves. And so some of your data points a pretty dire picture for the sustainability of the business model as it's currently organized. But to give us a little bit more of a sense of what some of the emergency relief can look like and what this work can look like going forward, I'm going to turn it over to Angie, who's going to give us a window into what LIIF has been up to.
Thank you. Thank you, Rob. Thank you, Naomi, and thank you, Rob and Bina, for those remarks that really helped frame the conversation about the incredibly tough situation that the early care and education sector is in. And for those of you who are living this situation day in and day out, huge thank you to you all for continuing to stay with us through this incredibly difficult time. So I'm going to talk to you a little bit about LIIF and what LIIF was able to do in response to the pandemic to help support mostly home-based early care and early care educators. There we go. So our vision and mission at LIIF is that everybody in the United States should benefit from living in a community of opportunity, equity, and well-being. And what we do is mobilize capital and partners to achieve this vision for people and communities. And as Bina was saying earlier, we are really putting a renewed emphasis on looking at social justice and racial equity to help repair some of the damage that's been done in the past and you can see how this really plays out in the early care and education sector. So LIIF is a community development financial institution. And for those of you who may not be familiar with those kinds of entities, as I was not as familiar before I came to work at LIIF, we're a nonprofit, but we're also a financial institution. And the main part of what we do is we take money from investors, banks, and other partners, and we work with community partners at the community level to lend that money out to build low-income housing, to build healthy food financing initiatives, schools. And then in the case of early care and education, because as Bina and Rob said, you can imagine that the ECE sector doesn't have a lot of ability to take on debt. So what LIIF does in the geographies where we work is we provide grants. And so in the over 20 years that we've been doing the work in mostly San Francisco, Washington, DC, and New York City, we've been able to create or preserve 273,000 spaces and invest over $169 million. And I wanted to put this slide in about 90% of a child's brain happens before the age of 5, just to help center us all in how incredibly important this is, not just to the economy, but also to the development of children's brains. So many of you who are doing this work every day, you're brain builders. Your work is incredibly important and why it is crucial for us to invest in this age of child and for the families. So the kind of work that we provide is grant administration wrapped up with a lot of technical assistance, because early care and education providers do not have a lot of experience with facilities development. So when we work with early care and education providers, we really help support their business skills and real estate projects to ensure that they can have a successful experience. And then we promote supportive policies to look at how we can reduce land use barriers and improve policies. Additionally, we are also playing a role around facilities in the California Governor's Master Plan for Early Learning and Care, and doing other work in counties like we've done in Sonoma County and San Luis Obispo County. We also use innovative financing like New Markets tax credits to improve and expand the supply of early care and education. And then I'm going to talk to you about the COVID relief program. So what we did when the pandemic hit is we talked to our grantees and asked them what they needed. The first thing that we realized is that home-based educators, family childcare educators, were the ones that were going to be hit disproportionately hard because they rely more on the private market. And Head Start providers and many state providers, that money was still flowing to them, but for home-based providers relying on the public market, private market, that was not happening. And their reduction in income and in enrollment was very significant. The other thing that we realized is that they needed some additional technical support to understand which products were out there could best meet their needs. So in terms of numbers, COVID-19 is threatening the permanent loss of roughly half the nation's childcare businesses. And as Bina had said before, these businesses, the majority of them are owned and operated by women of color. So what we did is we were able to successfully marshal 3 different types of resources. The first one was the Payroll Protection Program. Now, this financial product was not always the best one for the early care and education field because of the way it was offered. But what we found is that when we partnered with another institution, the Community Reinvestment Fund, to really help providers understand and apply for the funding, they were more successful. When they first applied just through their regular banks, many of them were not successful. They were kind of put at the end of the line or not given the response that they needed. But when we partnered with an institution that focused on small businesses, we were able to put $6.6 million into the hands of small centers and family childcare providers. And that was very helpful. And in a moment, I'm going to show you a video of one of our recipients and their reaction to receiving a PPP loan. We also were able to marshal $3.2 million in philanthropic funds in all of our geographies because those providers needed additional operations grants. And then finally, with our government funders, notably the District of Columbia and San Francisco, we were able to repurpose almost $3 million from facilities grants to operations grants, because we may have already given a facilities grant to a program, but if that program isn't able to remain open because of COVID, the facilities investment is not going to be useful. So we were able to repurpose that for operations grants. And then just within the last 10 days, we were also notified that we are going to be administering the City of Los Angeles CARES Act grant for childcare providers in the City of Los Angeles. And that is providing an additional $10 million of support to that community. So what I want to say is that we were not the only institution doing this. There were other institutions doing this. It is not enough. We need to do more. As Rob was saying, we need to ensure that there is a chorus of voices focusing on this field and supporting this field to ensure that their work is recognized. So we also work with Build Up California, which is a statewide network dedicated to sustaining and improving the supply of early learning facilities, and the National Children's Facilities Network, which is a coalition of stakeholders involved in planning, developing, and financing high quality early care and education facilities and business models, and encourage you to look at both of those resources. And so I'm going to show you the video of Luis Gallego. He is the son of, oh, you know what, I'm going to, hold on, I'm going to stop sharing just for a moment so I can reshare and have my sound optimized. so you can hear this video. So Luis is the son of an early care and education home-based provider, and he's the son, and he's an operations manager, and he talks about here. There were two videos that we could have shown you, but I'm going to show you what the second one that I'm not showing you is how he literally cried when he found out that his mother got the Payroll Protection Program loan. Here, this video tells you a little bit about how one early care and education small business really has a ripple effect on the economy.
Funding is extremely important. We don't know what the economical situation is going to be in the future. It's been tough, it's been rough, it's been a very difficult couple of months, and it could get worse if this drags on for a very long time. The funding is not only going to be important to sustain the business, it's going to be important because everybody who's going to be under the business is going to be able to keep receiving that economical assistance. Is going to be able to continue receiving a paycheck that is, in most of the time, is if all they have to pay their rent, utilities, or even food. So it's a domino effect. The fact that small businesses or childcare daycares or centers receive funding, it helps a lot of people. It helps a lot of employees. It helps a lot of contractors, and it helps a lot of parents. So it goes up and down. It helps everybody. Funding is extremely important. We don't know.
So you can see here how important it is to provide this support. And so we just have a few quotes here from a couple of other providers. Alice Mulligan says, "It's been a godsend to learn that there are people looking out for us. We're so used to being at the end of the line." And Angelica Guerrero from San Francisco talks about, this is our business and it's also our home. And so by supporting these providers, we're supporting their homes as well as their business. I just want to end by saying that if you take away nothing else today, early care and education is small business and it is a public good. And some of our solutions are to look at public funding, multi-sector partnership, and policy changes in order to make sure our economy can get back on track. And when it is safe, our early childhood educators can return to work and get the economy going again. So thank you, and back to Naomi.
Thanks so much, Angie. I think I'm really glad you finished on that final slide. I think pointing to the ways that public, private, nonprofit sector resources need to be harnessed to advance this work is really critical. And I want to turn the mic over to Amy to share how a variety of actors, especially business leaders and policymakers, are coming to the table in Washington to advance this work. So Amy, I'll turn it to you.
Great, thank you. Can you see my slides okay? Okay. Just wanted to appreciate having the time here today and being invited to this. You have a lot of folks, very smart folks who are on the panel with me. And I'm kind of this outlier. I work for Association of Washington Business. We are Washington State's Chamber of Commerce, as well as the Manufacturing Association. And we get a lot of questions about why is business involved in the childcare issue? What is our role here? Why were we a part of this? And you know, I got a lot of that from, and I apologize, my slideshow is not advancing. Okay. Okay, there we go. Sorry about that. We got a lot of questions when we started to be a part of this from our board members, our members. We represent about 7,000 businesses across Washington State in all industry sectors. And the majority of ours are small to medium-sized businesses. And as Angie said, our childcare providers are a business as well. But as was previously mentioned, you know, childcare, this is our workforce of today as well as our workforce for tomorrow. We need to make sure that we are taking care of our employees so that they can show up to work today, and that we have quality childcare and early childhood learning programs so that we are developing that next generation of workforce. And just as a side note, and I'll do this kind of throughout my presentation to give you a good idea of how the business community has slowly come into this conversation. And as you saw from some of Rob's slides from the US Chamber, they're doing a lot of good work around studying the issue. But we did have some really hard conversations at first when I talked about in our groups that we were working with about this being a current and future workforce. We actually had some providers and some agency folks say, whoa, we can't talk about our babies as workers. They're still young. We're talking about loving them and taking care of them. And that is true, but that is the basis, the foundation that we will prepare them to become workers. So it's an ever evolving conversation. When we surveyed our employers, we found that about 67% of them did report that they had childcare issues, which caused absenteeism among their employees. And of course, this has already been shared, there's a huge return on investment in investing in our early childhood learning and childcare efforts. So what I'm showing here is how did business get involved in this in Washington State? It was through legislative action. In 2018, we had the Child Care Collaborative Task Force established. It's run through our Washington State Department of Commerce. And one of the key components of this legislation is that it required business to be at the table. And as we work with the US Chamber and some of our colleagues across the country, that's not always the case. It's seen as a government responsibility to decide what's happening with our early childhood learning and our childcare efforts. And so Washington has been extremely successful in having our business folks at the table. I am part of I am one of 3 co-chairs or tri-chairs on the task force, in addition to a provider and a childcare advocate. So we have a really good grounding as far as the different perspectives and stakeholders who are at the table. When we extended the work in 2019, we did have some pushback, and we had legislators who wanted business absolutely out of the conversation. They felt like we had no business whatsoever being at the table talking about childcare. Well, in Washington State, where we don't have an income tax, we are dependent on business taxes and property taxes to fund our state. It is the businesses, including our childcare providers, who are providing the funding for this. So we've done as of last fall, 2019, we did an economic impact study on what was the impact to Washington State's economy and Washington State businesses of the lack of affordable and accessible childcare. Well, what we found was that directly, employers lose about $2.08 billion annually because of a lack of affordable, accessible childcare. And as has already been mentioned, that means people are unable to get to work. They miss their scheduled shifts. They lose their jobs. They are unable to take promotions or other jobs, career laddering possibilities, because they do not have access to childcare. And then overall, Washington State's economy loses a little over $6 billion a year because of a lack of affordable, accessible childcare. So we were able to, through the task force, do a little bit more digging down this year. At the beginning of the year, pre-pandemic, we had already had plans to take a deeper dive look into the industry because by legislative action, we are required this fall to present a list of suggestions, policy suggestions to the state legislature before they head into the 2021 legislative session in January. And as you can see by this list, and I won't read through all of them there, but you can see that there are childcare issues impacting absolutely every demographic of our working population. If you take a look at that first one, agree that childcare issues negatively impact the parent's job. Very broad group of employees. Go down to about the 4th bullet point, report having turned down a job offer or promotion due to childcare issues in the last 12 months. Unfortunately, that is impacting a lot of our lower income and already groups that are struggling, preventing them from increasing their learning potential. So it's definitely, as we've already pointed out, something that we certainly need to be paying more attention to. This is Washington State's, we already talked about childcare deserts. I believe on one of the previous slides, it did show 63% of our workers do live in childcare deserts in Washington State. So again, through our efforts, with our new industry analysis starting in this spring, we were able to pivot a bit and really take a look at how COVID is impacting our childcare industry. So as of June 25th, you can see there some the loss of capacity in childcare across the state. And if you take a look at, so up at the top there, Whatcom County on down to Skamania, that's about where our mountain divide is there. And so we always look at Eastern Washington, Western Washington, and Western Washington definitely has more of our population. And then of course, Eastern Washington, we have quite a few rural counties. So if you look at Columbia down there in bright red, 60% decline, Klickitat County, almost 77%. And then looking out onto the peninsula there, Jefferson County, 51% decline, Clallam County, 26% decline. A lot of these counties already had a critical shortage. And so as we start to look at how do we bring back our economy, we cannot have any type of a plan, we cannot have any type of an economic recovery discussion unless we are talking about childcare. And this is a good takeaway from that. Some other data points that we did find as we were doing the survey is that 20% of childcare providers were temporarily closed when we first started out. A lot of that had to do with they were categorized as essential workers, but they did not necessarily have enough children in it to stay open. 4% of childcare educators were laid off or furloughed in Washington State, and 64% of the childcare businesses that were surveyed lost over 50% of their income. We also found, and I think there was a question in the chat there, 30%, or the costs for childcare centers were about 30% higher due to increased sanitation, hygiene, and lower child to staff ratios that occurred because of COVID. So the last two slides, and you all will be getting those, really shows a lot of the data from Washington State's survey. Percent of parents who need childcare outside traditional hours, there's 25% there. Estimated average foregone personal income due to childcare inaccessibility, almost $17 billion a year. Percent of unemployed parents who consider a lack of childcare a barrier to reemployment, 47%. And I don't think we've seen that real number yet until we start really opening up our economy. So just as a wrap up here, before I turn it back over, again, I think that the part here that I was playing is where is business in this conversation and why are we here? It's critical. We have a vested interest, business has a vested interest in their employees' welfare, their employees' well-being. And that also means how do we get, where are we putting their kiddos? It's a tough time right now. And I give a shout out to all of you who are providing this service as I talk to our providers who are members, what they're going through right now and having to meet the regulatory environment that was already overly burdensome is just something that we certainly need to be paying more attention to. So any questions around, how do we get our businesses involved? They do need to be at the table. They are critical stakeholders in this. And our businesses do appreciate all that you are doing. So I'll turn it back over to you, Naomi.
Great. First, thank you all so much for sharing all of that information. We're getting a ton of really great questions from audience members, and a lot of them are kind of surfacing the issues around the differences between home-based care providers and center-based care, and kind of asking questions around, to Bina, is your data kind of inclusive of home-based providers? And to the rest of the panel is thinking about how resources are getting allocated to home-based providers versus center-based providers. So wanted to kind of float a question with all of you. How do we think about these issues, the differences between what's flowing toward home-based providers versus what's happening for center-based providers?
Yeah, I'd like to look at the answer to that. I feel like, so I've worked in California most of my career, and I believe this is fairly similar in California as it is across the country, that as Bina showed us, most of the country is living in a childcare desert, and we need all solutions, particularly solutions that work for families. We want to make sure that families have choices, and those families may choose a center, they may choose family childcare, they may choose family, friend, and neighbor care. We need everything, and we need to support all options. And so we need to make sure that when we're advocating for increased services, that we're advocating for them not just for centers, but for family childcare as well as family, friend, and neighbor care. In all of the work that we do at LIIF, we support family childcare providers as well as centers. And in our COVID relief response, we focused almost exclusively on family childcare providers because we knew they were harder hit because of their heavier reliance on the public market. I believe, personally, the family childcare provider that I went to when I was a child passed away a few months ago. And it helped me think about what an amazing anchor in the community that family childcare providers are in providing often generations of support to families. They went to family childcare and now their children go to the same family childcare. And it's important for us as advocates to lift them up and ensure that they are recognized as the anchors in the community that they are, and support their business so they can stay open and sustainable.
I could just add one comment. Certainly family childcare is an important part of the market in many areas, but particularly important in rural areas where we see such a dearth of supply. And it's hard for childcare centers to operate in places where there's not at least some density of population. In terms of the data that I provided, certainly the group size limit is going to have a pretty strong impact on childcare center classrooms. But both childcare centers and family-based programs are facing all of the health and safety related costs around sanitization and different protocols for working with kids and their parents.
Any other, Bina, does your data have you found any data sources that kind of compile some of your illustrative data points that cover home-based care?
I think, most of the wage data, I think the wage data combines both center and home-based. The cost data was center-based. So I think it can be both, but I feel like Angie and Rob's comments were great, and I really appreciate, Angie, you talking about the anchor. The anchor of your childcare provider in the community. I also want to acknowledge that for many folks, the small business run out of somebody's family is, that source of entrepreneurship in communities there's like undervalued and overlooked assets in communities that we have an opportunity to lift up and support folks who wouldn't necessarily, there's folks who wouldn't necessarily find employment in the traditional workforce who are able to do this. So I think it's very important that we're spotlighting, especially in the lowest income communities, how are we supporting families and acknowledging that there are barriers to them receiving the supports that they need.
Great. We have I had a bit of a magic wand question that I was going to ask, and we got the same kind of a question from one of our attendees. So, when you're thinking about having a magic wand and being able to institute a solution, whether that's a policy solution or a funding solution, what would you point to as something that might offer greater affordability, flexibility, cultural responsiveness to families and providers over the long term? What do you wish for?
Well, I'm the first one off mute, so I guess I could go first on this. Well, I've spent decades thinking about this and also really thought about how we can have local solutions. One of the things that I did before I came to LIIF was work on a local ballot measure that would have raised $150 million to help pay early care and education providers at least $15 an hour to improve quality and to provide over 20,000 scholarships. So I think we need to ensure it's more affordable for families. So families should not be paying more than the recommended amount, which I believe is not more than 8 or 10% of their salaries on early care and education. It should be accessible. It should be high quality, and that means it should also be located in a place where people are able to go, and offered at the hours when families need it. So it should meet families' needs, and it should also meet the workforce needs. So those educators need to make sure that they're earning a living wage so they can have retirement, and have health insurance. So I really think that we need public funding solutions. We need to look at early care and education as a public good. And we've started that conversation. There have been even more conversations about that now due to COVID and the spotlight on early care and education as critical to recovering from the recession and the pandemic. So if I could wave a magic wand, we would have public funding and public-private partnerships. The last thing that I'll say, and that this is a series of webinars, the last in the series of webinars is going to look at co-developing and co-locating early care and education with other community facilities and with housing to make early care and education even more accessible and convenient.
I'll just add a couple of things. You know, I think what Angie, what you provided, you know, a lot of important pieces there around the supply side and some of the demand too. Just to speak a little bit more on the demand side, the public support for families to access childcare certainly is funded. The reimbursement rates for childcare subsidies are funded at a very low rate. Those reimbursement rates need to be better to support the type of care options that they have available, and also the flexibility. In Minnesota, we've worked with an early learning scholarship fund, which provides scholarships to families where they can choose a variety of programs, and it's not dependent upon their work situation or the education situation. That is, families could focus those resources on their children and make sure that they have access to a quality program before they go to kindergarten.
So just to add to this, and noticing some of the questions in there, kind of on that, what do we all want, but how do we get there? And obviously some of the questions were, how do you fund it? What is the business community going to do? We have some really good businesses who do a lot of work in supporting their employees in this area. We have a couple who provide scholarship reimbursement type programs for childcare. Some of our bigger companies have established childcare centers on their campus with the intent of that is provided for their employees. It's part of their culture. But we have that question of, okay, this is going to require an investment. And in Washington State, about 85% of our education budget goes to K through 12, about 13% goes to post-secondary, which means a little under 2% goes to early childhood learning. That's inequitable. We know that, we recognize it. But can we say, what does that mean? How do we fund that right now? No, and it really, what it needs to be though is a longer term strategy on how we get there, because we do understand that investment in the upfront early learning is going to realize some savings down the road in our K through 12, our post-secondary, our justice system. And it's something that our policymakers have to take into account and think about as they are putting in place funding mechanisms for this. So there is no silver bullet. When you look at that across the country, nobody has any one funding stream, and no state has the necessary funds to invest. So, the only suggestions that I could say and what we've been working on is, again, business at the table, make sure that they are part of that discussion and really understand and make sure it's a long-term strategy that's put into place so that it is sustainable.
I'm noting the time. We have come to the end of the hour, which went so fast. I want to quick wrap us up. And in closing, first want to extend a hearty thanks again to all of our panelists, to my colleagues at the Fed and the Low Income Investment Fund for help designing and running tech support for this program, and to all of you for tuning in. We had upwards of 300 participants tuning in, and we know that these are really trying times in so many ways, and we're really grateful that you've taken the time to engage with us. Please plan on tuning in for the next 3 installments of this webinar series. You'll be receiving follow-up information in an email with registration information. There's also recordings. We'll share presentations. You'll get all the information. You'll also be getting a feedback survey, and we really want to hear from you. You'll see that the survey includes a number of open-ended questions. If you have the bandwidth, please take the opportunities to share your ideas, perspectives with us. We promise to read everything and use it in designing the next phase of this initiative. Thanks again, and we'll see you next week.